Then I would like to request Dr. Vijay sir, that how the hospitals and healthcare organizations, sir, contribute more effectively or can contribute more effectively to medical research. And what are the emerging areas, sir, do you foresee and you could see the possibilities of the collaboration?
Thank you, sir. I think the most important emerging area, first of all, let us understand what a century of medical advances it has been, and that has been because of research, whether it was introduction of antibiotics like penicillin by Alexander Fleming, or vaccines, or let's talk about robotic surgery, or you talk about the advances in cardiac care, ophthalmology care, cancer treatment, HIV, AIDS. So this should have been a golden era for the medical science, for the medical professionals. Unfortunately, if you ask, is it the golden era? The answer is no. Because I think the focus of our research has to shift now to the healthcare delivery. And that's where the institutions, the healthcare, that is where the healthcare delivery is happening. And let's understand that in a country like United States, where they are spending the GDP of our country, equivalent to the GDP of our country on their healthcare, there, the preventable medical errors are the third leading cause of death in that country. So much so that the estimates are more than 200,000 Americans are dying because of preventable medical errors in the hospitals every year. And therefore, this is an area, and their accreditation bodies have been in existence for last 80 years, as compared to, let us say, our NABH or something which has been there now only for 18 years. It is kind of bringing very clearly that merely accreditation is not going to change it, because we have not tried to focus on research as to how to prevent medical errors and things of that kind. And that's where everything, lot of things. So recently, for example, if you take artificial intelligence, now one of the robotic things that you see in the hospitals, that the nurses taking pulse and blood pressure after every 4 hours. They do it sometimes, again, the task is so boring, sometimes they don't do it, it is being copied. And it is seen that nurse has taken, let us say at 8 a.m., the patient has developed a code blue 15 or 20 minutes later. So now there are kind of innovations that are coming, which is giving the data on the pulse, respiration, blood pressure of the patient continuously. And therefore that data is now can be communicated to the clinicians also in time, and therefore saving huge amount of precious lives. So I think the hospitals, like in the past, in the previous sessions also it has been said, first is that I think in our medical curriculum, we need to include a topic to sensitize the graduates about the importance of medical research. It is also to, I would say, emphasize to the hospital owners and the clinicians about the importance of medical research. In fact, nowadays, a lot of people come with different kind of, some vendors will come. Recently, see, I bring you, let's say, greetings also from this organization that we have created called CAHO, which is the Consortium of Accredited Healthcare Organizations. And our focus is exactly on only promoting patient safety and quality, and to take the hospitals beyond accreditation. So for example, now somebody came and said they are using games to provide education to the nurses, to the doctors, but games as a medium. So we are now trying to test out those games in some of the hospitals. It will be taken as a research. That is your claim. But let us see what kind of an impact that particular modality. So I think the scope to do research in the hospitals is huge. And especially I'll say the focus has to be more on the healthcare delivery, which should lead to safer care, because otherwise, in spite of huge advances in the medical care, we have reached a stage where I think one is becoming afraid, because I think Patient safety and professional safety are directly interlinked. So the amount of professional violence, the litigation, all that is linked to our not focusing on safer care. Thank you.